They came to burn it down, and when the flames took hold, the patients ran. 18 people, carrying a virus with no vaccine, no treatment, and a 1 in 3 chance of killing you, are somewhere in the community around Mongbwalu. It is the second treatment center burned in a week, and the outbreak may already be beyond containment. They came to burn it down, and when the flames took hold, the patients ran. Angry residents attacked and set fire to a treatment tent run by Doctors Without Borders in the town of Mongbwalu, at the epicenter of Congo's Ebola outbreak. As staff fled the blaze, 18 people with suspected Ebola infections escaped into the surrounding community. Their whereabouts remain unknown. It was the second such attack in a week. Days earlier, a treatment center in the town of Rwampara was burned to the ground after residents were prevented from retrieving the body of a man suspected to have died of Ebola. The hospital director in Mongbwalu, Dr. Richard Lokudi, was unequivocal about what the attacks meant for containment.
We strongly condemn this act, as it caused panic among the staff and also resulted in the escape of 18 suspected cases into the community.
Burials have become a flashpoint. Ebola victims must be interred under strict protocols because their bodies remain highly contagious. Families prevented from conducting traditional funeral rites have pushed back hard. In Rwampara, on May 23rd, armed soldiers and police were required to escort Red Cross workers in protective suits as they lowered sealed coffins into the ground, while crying relatives were made to watch from a distance. Red Cross team leader David Basima said his team faced significant resistance and had to call in security forces for protection. The scale of the crisis is growing. There are now 750 suspected cases and 177 suspected deaths across Ituri province. The WHO has upgraded the risk level for Congo to very high and says the true number of infections is believed to be significantly larger than confirmed figures suggest. The Bundibugyo strain driving the outbreak has no approved vaccine and no specific treatment. The United States moved on May 22nd to ban green card holders who have recently been in Congo, Uganda, or South Sudan from re-entering the country, citing the need to ensure screening and quarantine resources remain available for US citizens. 18 people are now somewhere in the community around Mongbwalu. Health workers do not know where. But with treatment centers under attack, distrust growing and suspected patients disappearing into the population, health officials fear the outbreak may be slipping beyond containment. Authorities have now banned funeral wakes and gatherings of more than 50 people across northeastern Congo. It spread for weeks before anyone noticed. By the time the alarm was raised, it had already crossed borders. A deadly Ebola outbreak is spreading rapidly across Eastern Democratic Republic of Congo and Uganda, raising fears that global aid cuts may have delayed the response and allowed the virus to spread unnoticed for weeks. This Ebola outbreak is unlike anything the world has seen from this virus in years. It is caused by the rare Bundibugyo strain, named after a Ugandan region where it was first identified in 2007. There is no vaccine for it. There is no specific drug to fight it. It kills roughly 1 in 3 of those it infects. As of this week, at least 139 people are confirmed dead, and more than 600 cases are suspected, according to the WHO, which has declared an international health emergency. The delayed detection has raised uncomfortable questions about what enabled it. Initial laboratory tests returned negative results because they screened for the far more common Zaire strain, not Bundibugyo. Armed groups displaced civilians in eastern DRC in early 2025, allowing the virus to travel untracked. Then there are the cuts. US epidemiologist Eric Feigl-Ding, who was among the first scientists to flag the emerging COVID-19 outbreak in January 2020, was direct about what he believes happened.
USAID used to have this when it was on the ground, giving out medication and funding local healthcare workers and clinics to do this. Now, USAID is gone. This is clearly one of the examples of what happens when you decimate the healthcare infrastructure in a lot of these countries.
Under the Trump administration, USAID had 90% of its budget cut. Elon Musk, then head of the Department of Government Efficiency, admitted in February 2025 to having accidentally terminated some Ebola containment programs. The CDC also lost 25% of its workforce under Health Secretary Robert Kennedy Jr., including key Ebola staffers who were fired and then rehired. The US formally withdrew from the WHO in January 2026, ending contributions that had totaled over $1.2 billion in 2023 and 2024 alone. Julie Drouet, Country Director of Action Against Hunger in the DRC, told DW that the resource reduction had consequences.
The reduction of resources in the DRC, both humanitarian and health-related, is inevitably harmful for the Congolese population, and to some extent for epidemic prevention and detection.
The World Health Organization has released an initial $3.9 million emergency package. But health experts warn that a far greater international support will be needed to prevent the outbreak from escalating further. An American doctor is on his way to Germany for treatment. More than 500 people are suspected of being infected. At least 131 are dead. And the world, for the first time in its history, is dealing with an Ebola emergency declared before a single committee meeting was even convened. The outbreak of the Bundibugyo strain of Ebola in the Democratic Republic of Congo has been spreading since at least late April, most of it undetected. The first death was recorded on April 24th in Bunia, the capital of the eastern Ituri province. When samples were sent for testing, labs looked for the wrong strain. They came back negative. Weeks were lost.
First, beyond the confirmed cases, there are more than 500 suspected cases and 130 suspected deaths. These numbers will change as field operations are scaling up, including strengthening surveillance, contact tracing, and laboratory testing. Second, cases have been reported in urban areas, including Kampala and the city of Goma in the DRC. Third, deaths have been reported among health workers, indicating healthcare-associated transmission. Fourth, there is significant population movement in the area.
By the time the WHO was alerted to around 50 deaths in Mongbwalu on May 5th, the virus had already moved. Cases have since been confirmed in Goma, Butembo, Nyakunde, and across the border in Uganda. The first case was only officially confirmed on May 14th.
I would say that our concern about this outbreak is pretty high. This is Bundibugyo, which is a Ebola strain that we have only a couple of outbreaks have occurred historically, so we have less experience with this strain, but I think we are concerned that it will behave like the Ebola that we know well. It's occurring in an environment that proved really, really challenging in 2018, 2019, when we had a vaccine already ready and were able to deploy that.
The American doctor, identified as Peter Stafford, had been treating patients at Nyakunde Hospital in Bunia since 2023, when he developed symptoms. His wife, Dr. Rebecca Stafford, was also exposed but is not showing symptoms. The couple have 4 young children. 6 other Americans have also been exposed and are being moved out of the country.
So far, 30 cases have been confirmed in the DRC from the northern province of Ituri. Uganda has also informed WHO of 2 confirmed cases in the capital of Kampala, including 1 death among 2 individuals who traveled from DRC. And there is 1 US citizen confirmed positive and transferred to Germany, as reported by the US. And we're working with the DRC, Uganda, and also the United States.
Ituri province, where most cases have been reported, is in the middle of an armed conflict. Over 100,000 people have been newly displaced since late 2025. In an Ebola outbreak, displacement does not just complicate the response, it accelerates everything.